So this is the list published by Pfizer, and it looks like this list, which is indeed long, are events that doctors and nurses should be looking out for, not events that have actually been reported. So no two ways about it. My apologies, I've got that wrong. But let's just look at it a little more. So this is adverse events. This is direct screenshots from the paper, adverse events, and then adverse events of special interest. That's from the whatever you call it, the bit that tells you what all the titles stand for. And this is the lead into the actual list of side effects. Cumulative analysis of post-authorization adverse events reports. Now, I think the problem here is that it's just not very well phrased. Let me just show you that. But that's it actually, well, it's on top of all of them there, look, it's on top of all of them. So they're things to look out for. Now, to tell you the truth, I didn't know this. And it turns out that several doctors I've talked to, actually on both sides of the pond today, didn't know it either. And in fact, of the several doctors I've talked to, none of them did know that this list was things they had to look out for. So apparently that's what it is. So let's look at it in a little more detail. Now, I must confess, because I wasn't very up to date on this, I've basically plagiarised Dr. Jesse Santano on this, who publishes a nice sort of pre-say of it. So let's look at what Dr. Santano is saying. So an adverse event of special interest is an event for a particular product that should be monitored by a drug or vaccine manufacturing company. So it's something that they should be monitoring for. So in other words, all doctors, nurses, nurse practitioners involved in this should be monitoring for all of these. Now, I've had a look through these. I'm not going to bore you with them now, but I can work out what most of them mean. But not all of them, I must say. There's some pretty obscure stuff here. I mean, off the cuff, I don't know what Fettel's syndrome is. I know what ephemeral artery embolism is, but if you see, there's a lot of specialised terminology here, and then at the end, it just kind of, eventually, it just stops. There you go. Things that doctors have to look out for, but apparently most doctors and nurses don't know they have to look out for it. Now, if they don't know they have to look out for it, I would have thought this could lead to significant underreporting, because the doctors I've talked to didn't know they had to look out for this. But let's carry on with Dr. Santano's rather useful analysis. It can be severe or non-serious, but it can lead to a serious medical condition. And he's going according to this group here. This is the Council for International Organisations of Medical Sciences, which seems to be related to the WHO and the United Nations, so Educational, Scientific and Cultural Organisation, from memory. So it does seem to be this recognised agency that's put forward these guidelines. Now, Dr. Santano again. Where are we? Such events should be described in protocols or protocol amendments. Good, and we see rightly that's what Pfizer have done. That's what this is. So they have described it. A pity it took. My understanding is it took a court order to have this paper released. So quite how you were exposed to know before the Freedom of Information court order, unless this was in the public domain before, but we looked before and it looked like this has been released as a result of a court order to me. Correct me if you think I'm wrong on that, but that's what it looked like. Anyway, and instructions provided for investigators of how to and when they should report to the sponsor. So I can't see that. I can't see any instructions there on this document as to how you report that. Sorry, you'll be getting dizzy looking at all these going up and down. I can't see anything there before it saying how you report it, and I can't see anything, that was after it rather, and I can't see anything before it. I don't think I saw anything before it either. No, it just says the summary there. So can't see that. So they're rightly including it, but I can't see that. I can't see that bit. The organiser, the original Pfizer appendix is a wall of words indeed, with the diagnosis separated by semicolons. More than 95% of the adverse events listed are life-changing for the bad, so we certainly don't want those. If you're lucky enough to have a diagnosis from your doctor and he says it's not related to the shot, now, of course, most of us wouldn't think we were particularly lucky to have a diagnosis from our doctor, but I think he means if you're lucky enough to be able to see doctors, because it is quite difficult at the moment. I've just had to... my last appointment was on an e-consult thing. So, but anyway... and your doctor, and the doctor says it's not related to the shot, then Dr. Santana says, show them this list. So we need to show, if you've got any problem that you think might be vaccine related, and your doctor says it's not, then show them this list to make sure it's not in this list, because if it is in this list, then the adverse event should be reported. Clearly not a straightforward matter, but that's what the guidelines are saying. Show them this list. Tell them that Pfizer is watching out for those complications. So Pfizer put this there because I think they genuinely want to know if they are turning up. Dr. Santana again, many doctors, nurses, practitioners or physicians don't know. Well, I didn't know, and the several doctors I've talked to today didn't know either. So it looks like we're pretty ignorant of that. Dr. Santana says, I didn't until I read the whole list, so we are... Well, Dr. Santana is clearly less ignorant than me, because at least he knew the list existed. Many of the conditions below are rare. That means doctors might have forgotten about them or not know about them. Rare also means there may be no standardised treatments for them, which is, that could be a problem. The diagnosis on the list does not mean they always happen with COVID-19 shots, of course not. But anyone who got vaccinated and then diagnosed with the illness, Dr. Santano's inverted commas, I'm not quite sure why I put that inverted commas, and then diagnosed with the illness below should be reported to Pfizer or VAERS. So given that most doctors and nurses, from my completely unscientific straw poll, don't know it exists, how can they report it if they don't know it exists? So if you're a nurse practitioner, doctor, physician's assistant, and you know this list exists, please tell me I'm wrong, but I didn't know it existed. And several doctors I've talked to today didn't know it existed. The diagnosis may be months or years after the shot, you can still report them. The World Health Organization is also keeping an eye on adverse events of special interest, of course. Adverse events of special interest monitoring, determining if there is a high incidence of specific disease in people who had the Covid shots. Well, we know, for example, that there is an increased risk of heart inflammation. That we established that in yesterday's video, and indeed in many others. If the incidence is higher in people who've had the shots, they should stop using these vaccines. Well, the incidence is higher in people that have had the shots, so according to this thinking from Dr. Santana, well, there you go. That's what this article is saying. I don't feel I can comment on that, but that's what this article seems to be saying. And these should be getting reported, that is if they do their job. This list may be from Pfizer, but all who had Covid shots, whatever the manufacturer, should report their diagnosis. Of course. This is just a Pfizer paper that we have here. So if doctors don't know about these, then I'm not sure they can accurately report them. I mean, dear me, metastatic pulmonary embolism, I know what that means. Microangiopathy, I know what that means. But some of them I don't. I mean, yeah, most of them make sense, but some of these are things like Miller-Fisher syndrome. I can't remember what that is. Mitochondrial aspartate aminotransferase increased. Well, I haven't got a clue about that. Mitochondrial diseases. I mean, I know an expert in mitochondrial diseases, but I think if you ask most doctors what mitochondrial aspartate aminotransferase increased means, they'd be struggling as I am. So there you go. Apologies, I got that wrong. It is not side effects that have been reported. It is side effects to look out for. But as we say, most doctors don't seem to know about it.